and I really appreciate that she keeps inviting me to come. In terms of wearables, I want to do a little bit of level setting. So I'm a regulator. I'm a privacy and security regulator with respect to health data. My office has stewardship over the HIPAA privacy, security, and breach notification rules. But the wearable space is really a big challenge for us because we can't touch an enormous share of it. Our authority is limited by Congress. We can regulate what are called covered entities, and we can regulate the entities with whom they do business, who are doing things on their behalf and who get data from them in order to do that. They're called business associates. So a covered entity is most of the medical professionals, the doctors, pharmacists, laboratories, as long as they are billing healthcare insurers using the HIPAA standard transaction code. So that is super obscure, but it is due to the fact that the rules emanated from a piece of legislation that was not designed to protect privacy, but was instead designed to make sure that, to sort of get administrative efficiencies out of the healthcare system by having people billing and doing standard payment transactions electronically and using standard code sets. So really quite narrow swim lane. And so the professionals that are billing electronically using our HIPAA code sets get covered by HIPAA's rules. If they are not, for example, if they are self-pay only, they will not be covered by HIPAA. Similarly, we cover health plans, of course, because they were part of that ecosystem that the statute in 1996 was aimed at. And again, and these entities called healthcare clearinghouses, which put data into standardized format and unwind that transaction. They have a very specialized role in the payment-related transaction field. So from that sort of narrow coverage bubble, they gave HHS a bunch of authority, frankly, quite broad, to enact privacy and security rules. And then in 2009, they upped the ante on that authority by giving us a set of requirements around breach notification to implement, and also upping our penalty authority. So we do actually have substantial enforcement authority, substantial penalty infrastructure. We have a robust penalty infrastructure that includes 8 different regions and investigators there, and we also have the authority to audit. But again, with respect to wearables, unless that wearable is, when it's feeding data into a covered entity, like into an electronic medical record, then the data is going to be subject to HIPAA rules within that environment. But when the consumer is wearing it and it's generating data and sending it off to the manufacturer of the device, for example, that's not likely to be covered by HIPAA. And so what does that mean from a privacy and security standpoint? Well, the Federal Trade Commission has authority under the FTC Act to crack down on unfair and deceptive trade practices. And I'm going to leave to my fellow panelists if they end up talking about their experience with the FTC in terms of the footprint that they have in this space, because it's not an agency where I work. But it is an example for those of you who have a global orientation of how we in the United States tend to regulate the space of privacy and security in a very sectoral way, and the protections do not stick to the data. So unless that data is held by an entity that is covered by HIPAA rules, it is not going to be protected by HIPAA's protections. So say what you will about whether you love HIPAA, hate HIPAA, thinks it goes too far, think it doesn't go far enough. It does provide a baseline of protections, however, only to limited data. And it didn't used to be so limited, frankly. It used to be that most healthcare data that we knew of was collected and shared within that sort of traditional ecosystem. But that is not really the case anymore. And wearables are pushing the boundaries of where that data gets collected and where it goes. And it isn't subject to HIPAA's rules. It is instead subject to the FTC's jurisdiction around unfair and deceptive trade practices. I think the other thing that I will mention is that we have tried to do more guidance to reach out to both the public as well as to industry I guess they are members of the public as well, right? Industry and other stakeholders in the public to educate folks about when HIPAA's protections attach and when they do not, because there is a lot of confusion out there about, when you have a wearable and there's health data and it's flowing in and out of HIPAA's ecosystem, when is it covered and when is it not? And we have on our website put up more guidance about that. And in fact, we have a special site that we have dedicated just to answering questions from developers about when HIPAA applies to their products and when it doesn't. And we do get questions from vendors who are making apps and vendors who are making wearables about when our authority might be triggered. Again, it's very limited, and so there's sort of a set of scenarios for, as a matter of fact, on this webpage, which is actually not on our main site, although there are plenty of links to it on our main site, but it's HIPAA Qs, Q is in question, QS portal .gov.hhs.gov. HIPAA Qs portal at HHS. HIPAA Qs portal.hhs.gov is a site that you can go to. It's open to the public, even though it's aimed at the developer community. Anybody can go read it. Anybody can post a question. We've actually been doing what I think is a pretty decent job from a government agency standpoint of responding to people's questions. It's not instantaneous, but within some weeks, we've been able to put up some responses. Some of them have been more timely than others. We're trying to bring government into the 21st century with respect to use of websites where people leave questions and we comment back. The other piece of guidance that we've done more recently, which I think is going to be quite relevant to the development of wearables, even if it doesn't change the boundaries of what we regulate, is our guidance on the right of individuals to access their health information. So under HIPAA, entities who are covered by HIPAA's rules as covered entities are required to provide individuals with access to and a copy of their health information when they ask for it. And we put out a lot of guidance about what the parameters of that right are, including what's the scope of the right, much more information than I think a lot of entities thought, including notes. We clarified that the individual has the right to get this in the form or the format that they want, as long as the entity can produce it in that format. It's not that the entity wants to produce it in that format, it's that the entity can actually do it. They have the equipment, they have the technology, they can satisfy the request. And probably most importantly, for those of you who have ever tried to get a copy of your health information and been faced with a bill for lots of fees for that, we have also put out clarifying guidance on the fee limitations that apply when an individual is trying to access information for herself. And that includes a circumstance where she's accessing it for herself, but she wants it sent directly to a third party, like an app. And so there are still, I think, a lot of questions that many of the providers who we cover have about making connections to patient apps, making connections to patient-facing wearables to be able to facilitate the download of information that the consumer may want to populate an app or some sort of wearable device, if it's not a device that is just gathering data from the person, but also is intended to collect other data and provide the consumer with a more full picture that she could then use to help manage her health. So that's what we've been doing in order to try to both sort of encourage this space, because we do think there's a lot of promise there to wearables and apps, but at the same time recognizing that there are limits to what we can do. We work with the FTC quite frequently, and oftentimes when we get complaints, for example, in our complaint portal about a HIPAA violation that is in fact something that falls within their jurisdiction, we are working with them now to have a more regular process for feeding those complaints over to them. So with that, I think I will hand it back over to Jana and my fellow panelists. Thank you again for the opportunity.
We're going to go back and forth, though.
Not only on slide two.
That's all right. I'll start.
You start.
They're much better coordinated than I am. They're going to really show you a show.
You'll see. I think you should both stand up here.
Both?
Yeah.
Okay, you got it.
That's fine. Let's do it.
Okay. Thanks very much. I'm Catherine. This is Jeff. We're going to present this together. And we have together and separately been tracking the digital marketplace for about 2 decades and have been involved in not only research but a lot of advocacy. One of the things we did in the late 1990s when we were running a nonprofit together was to lead the campaign that resulted in the passage of the Children's Online Privacy Protection Act, which took effect in 2000. And Jeff will talk a little bit more about what the Center for Digital Democracy has been doing. We've been doing research on this issue for about the past year on this emerging market of health wearables. We've been conducting interviews, going to conferences, and reading articles and trade reports from the industry. And our goal is really to develop a scan of what's happening to identify what the major trends are, who the emerging players are, and what the practices are, and specifically what the privacy issues are that are raised here, and to work with the privacy and consumer protection and health and civil liberties communities to develop a public interest framework for protecting consumer privacy in this space. And we're focused on consumer wearables. As Devin was saying, and we'll talk a little bit about this at the end, wearables fall within a category that's not regulated through HIPAA, and it's not regulated by the FDA either unless they're medical devices. It's a very complicated environment, and it's quite fluid at this time, which is really, really interesting. We're planning to release a report in the near future that will lay out what our findings have been, as well as our ideas and the ideas from the consumer and privacy and health and civil liberties communities about what we ought to do to protect consumer privacy. What should we be thinking about? So, Jeff?
And first, I want to thank Deborah and the organizers of this conference for their great work, and for inviting us. Well, you all know, and you've heard it today, and I'm sure you, in your own work, you deal with it. Why is this important? Because the future of our health system, both at the professional level and at the consumer level, is being built upon this incredible data collection apparatus, this octopus that has been created over the last few years, which we'll go into in detail shortly, but the previous speaker, and I forgot her name, from Edinburgh, covered some of this in your earlier speakers. Data collection, targeting, personalization, 24/7, all to drive behaviors. Behaviors principally around acquisition, purchase, desire of medications and drug treatment. So precision medicine, the other side of precision medicine is really what they call precision marketing today. And it has not gotten the attention it deserves. So it's all about one-to-one targeting, and it's all about more than one-to-one because of our social relations. It's now what your social network is doing. Because of big data analytics, they find out what your interest is, and they can find people like you all over the world who have the same interests, et cetera, and then target them for the same kind of medications, prescriptions, and medication. So we felt we had to intervene, that the public interest privacy community had to intervene, because industry has no intention of protecting our privacy, generally when it comes to the health marketplace, with a few exceptions. And government is certainly lagging in really protecting us, which is why we were in yellow along with Russia in terms of privacy legislation. So we have this project, which is part of a larger project that we, and I'm sure you're also working on, to have a meaningful culture of health that includes privacy at its core.
And as Jeff was saying, this is an emerging market where a lot of money is being invested. Something like $9 billion in venture capital is funding the, need to switch the slide there, is pouring into this market because of the potential for so much money. I mean, they're still in the early stages, and I know I have people commenting to me when they see my Apple Watch, because not everybody has one, but a lot of people are wearing Fitbits, and more and more people are using these devices. And for many in the startup community, it reminds me, when I look back in the early days, a little bit of the dot-com era with a lot of excitement and some sense of the Wild West, which a number of people were talking about at conferences that we've attended. And it's also part of this movement, as it's called, for the quantified self, with health and wellness and fitness devices really driving a lot of this growth. And a lot of promise out there. Certainly a promise if more and more people use these devices for addressing some of the serious health problems we have in this country: obesity, diabetes, heart disease, for example. And a lot of large companies are embracing wearables as part of their wellness programs and offering incentives to their employees. Target recently made a deal with Fitbit. Fitbit's working with a lot of other companies to do this. Obviously, not only are these devices intended in their to improve the health of employees, but also to reduce cost and help productivity. And there was a recent EEOC ruling I'm not going to go into on wellness programs that a number of you may already know about, having to do with the potential of these programs to discriminate. And wellness programs, to the extent that wearables are part of that, they figure prominently into those debates and to those issues. Also, wearables need to be understood in the context of this emerging Internet of Things world that we're all living in, where everything in our surroundings is soon going to be smart. I remember walking by my 92-year-old mother not long ago, and I had my cell phone, and she said, "What kind of phone is that? Is it a smart?" And I said, "Yeah, Mom, this is a smart." These days, everything is smart, right? So it's not just your appliances and your cars and your energy system, but we're looking more and more at embedded sensors that are linked to wired and wireless networks, like contact lenses that will be able to track the blood sugar levels, and those would be medical devices that would then be able to give that information to the consumer. I would assume they would be, and perhaps to the doctors as well, and things that people might ingest into their digestive systems to see how things are working. The other thing is that with all of the innovation and increasing sophistication in the marketplace, these devices are set up to not just collect what we tell them, but to track what we do and what our bodies are doing, often without our understanding of what's going on. So for example, the Samsung bioprocessor, which was among the 700 or more exhibits at this year's Consumer Electronics Show, measures your body fat, skeletal muscle mass, heart rate, heart rhythm, skin temperature, stress levels, all of those things. And they're increasingly being integrated into our social media worlds and our social environment, so that these devices are encouraging us not just to track our health, but to communicate with other people, to be part of our social interactions that have grown and become so dominated by what's going on in the digital sphere. And then the other thing is that, as I mentioned, many of these devices are not regulated by the FDA. They are consumer devices alone. This is one of the startups that I think is an interesting illustration of kind of the direction of some of these things. This is called Think, and it uses neuroscience to manage energy, stress, and sleep. So it's actually designed to sort of tap your moods, to let you know about your moods, and to track what's going on in that area. And they're billing it as the first consumer wearable to improve a person's mood. That'd be good. Here's another example of what's happening in this market space. This is smart clothing. There's a lot of lines of smart clothing for athletes, for example, to track what's going on with the body. This is another one that reminds me, and Jeff and I are married to each other, of when our baby was little and we had one of those baby monitors for anxious parents to listen to everything. This is smart clothing to monitor a baby's vitals. And some products are featuring, for example, smart coffee cups, so that while you're having your morning coffee, you can be tracking what's going on with your baby in the other room and not worry. As the caffeine makes your heart rate go up, which it will monitor on your coffee cup maybe, or whatever else you've got, at least you won't have your heart rate go up because your child's having problems. You'll be able to be very calm about that, which Think will help you take care of too. And here's another example of of what is called haptic technology, which is the ability of these Internet of Things, all these objects, to simulate touch. And in this case, it's a tea jacket, like a T-shirt that can hug a child. That could be very helpful for autistic children, for example. And so there are lots of potential uses for these things. You want to move in over here?
All right, we track the digital marketplace, principally in the United States, but to the extent that we can throughout the world. The commercial digital marketplace, finance, health, marketing to children. In 2010, for example, we filed a complaint with the Federal Trade Commission about what I call digital pharma. And we're going to walk you very briefly to give you a snapshot, just a glimpse of just some of the current applications that have been deployed to target health consumers. I think it's important just to reiterate that the health system today, the digital health system, and the system that Wearables is being built upon, is the system that has developed over the last few years in the United States because we don't have the ability to regulate privacy. Our children's privacy law is the only online privacy law that the United States has in terms of the consumer marketplace. The minute you turn 13 in this country, you no longer have any meaningful privacy protection in the commercial marketplace. The Congress took away the Federal Trade Commission's power to regulate back in the 1980s. So what do we have now? And when you think about health privacy and you think about health wearable privacy, what do you have to think about? And here's the foundation. You're now tracked regardless of device. They're now able to identify a single person and track you, whatever device you're using, and now they're doing that with the television. They're now able, because of our use of mobile devices, to know your real-time and historic geolocation and target you and know when you're entering a store, going to a competitor's store, and do all that in real time. They're now able to access in real time an explosion of data sources consolidated in what is called data marketing clouds. IBM has a data marketing cloud. Adobe has, Salesforce, et cetera. You've thought about data brokers before. These were small and large like Axiom. Today, they are all working together, and including in the health area. What happens to all this data? It is now processed and made actionable. That's the term that the industry used. Made actionable in real time through data management platforms and programmatic ad exchanges where we're sold to the highest bidder in 20 milliseconds when we're on our PC, our mobile device, and our gaming platform, and increasingly also television. So that is the system that the commercial consumer app marketplace, by and large, is part of. And because, once again, we have no privacy protection. So this, at the last Consumer Electronics Show, when IBM's Watson talked about its work in improving health, they made two announcements, and one of it was with Under Armour. And Under Armour, which makes fitness clothing, as you all know, how many people know that Under Armour has an ad network for its health products? And that if you go to the marketing kit, you will see advertisers, health advertisers, other advertisers, we can get all this valuable health app data. And that's first-party data. That's your data. The industry calls first-party data the data that you have that they collect. That's first-party data. And look at what Under Armour says. This is from January of this year, that it can do using its 160 million person network that is part of Under Armour. I know I got to go fast.
Next.
Next, the hook. Here's another example. And look, you can read this for yourselves. I could not make this up. And really, I've been in business for years because the industry writes my material, and I thank them for it. But this is also part of Under Armour. Unprecedented breadth and depth. That is what they're promising health advertisers and other advertisers if you use an app from Under Armour. Let's do the next one. Oh, I see here. Now, here's another example. And this is very, very typical of the specialized health data targeting ad networks that have developed over the last half dozen years. And you can see it's so much for privacy. Oh, we can target by prescription. We can target by electronic health record. We can target, et cetera, et cetera. All of this information, I mean, the companies claim it's anonymous, it's aggregate. It's not. It's highly personalized. And even if at the moment it may be an aggregate, because of the applications, I left this out, because of the interactive advertising applications that have been created to go alongside with the data collection to make that data very, very useful, including neuromarketing, where they test consumers' reactions by hooking them up to EEGs, et cetera. The sentiment mining that was talked about earlier, the big pharmaceutical companies and all the leading companies have 24/7 social media monitoring platforms where they figure out who's talking, who are the influencers. I can target you to target you. This is very typical of what else is going on. Next one. Now, I just want to underscore this because this shows you that pharma, and this is the lobbying organization for pharma here in town, Digital Health Coalition, that pharma is using the latest privacy-threatening techniques to drive health advertising and health behaviors. Programmatic is the term the industry uses. It now dominates the global advertising system. Programmatic is the real-time auction of individuals either to the highest bidder or preferred advertiser, regardless of device. You are chattel. You are cut out of the decision-making. All that health data and other information, your financial data, your racial ethnic data, whether there's children in the house, all of that is fed into those data management platforms and programmatic ad networks for real-time decision-making about drug ads, about over-the-counter ads, et cetera. Next. And here's just another, I mentioned this earlier, but I just want to underscore it. This is very typical of what is happening today. If you cover the data industry, the commercial data industry like I do, this is a hall of fame, shame. The most powerful data companies, in the United States, on the planet, they actually work in the EU, et cetera, too, all working together, compiling a diverse range of information to target health consumers. All right? And what's the next one? And then, of course, this is another very popular genre within the digital drug industry. And I should underscore, look, we have been concerned for years as a country about direct-to-consumer pharmaceutical marketing and what we see on television, et cetera. We've not been able to regulate it, and we're glad that the American Medical Association, maybe was it 6 months ago, 8 months ago, called for the end of direct-to-consumer drug advertising, which I personally support. They have created digital-to-direct consumer advertising. It's going to be more powerful because, remember, it follows you from site to site. It learns about you, right? It learns what your friends do. It's very appealing. It offers you discounts. It offers you free music. It offers all this stuff, right? If we don't regulate this DDTC, as I call it, then the concerns and the experiences we've had, where people are asking for all kinds of branded medications without really evidence that they need it, I believe will further explode. So yeah, I can target you by condition. Think about it. They'll claim they protect your health privacy, but I can target you by any of those conditions there. Thanks. And then, there's also, as latest iteration, thank you for pointing this out, there's also ad networks now for the wearables. And this is just one. And let me just say that they're using all the techniques that are really part of the consumer digital marketplace. They know where you shop, they know where you buy, because they can get that information from the pharmacies and from the supermarkets. They're encouraging you to enter the loyalty program, so they get even more first-party information about you. That's one example. Here's just another example of a wearable ad network, FitAd, where they make all kinds of promises about targeting consumers, and even a specialized one for the Apple Watch. And let me underscore that GPS allows that what the industry calls hyperlocal targeting. I mean, there's just an explosion of sophisticated ways to know and take advantage of your real-time location today. And you're scored along with your location. Do you live in a poor neighborhood? Do you live in a wealthy neighborhood? What ad should I send you if you're poor and need a loan, et cetera, et cetera? All this is part of the marketplace that is basically being ignored by regulators today. And the industry, like other parts of the digital marketing industry, is engaged in very extensive research to understand how people react to these wearables, how they can, in fact, create new ways to make people want to give up their data to wearables. So understanding and to tap into the psychological needs, as you said. All right. And the industry will say proudly, well, it's opt-in. Don't worry about your data being collected. You have a choice. But the fact of the matter is, and here's one company, brags, oh my God, look how many people who have opted in to this kind of real-time targeting. There's really no privacy for apps for the most part. And the apps are kind of the Trojan data horse that allows all kinds of information to be collected. But the ways that the industry has created to get you to opt in raise questions about whether or not the so-called opt-in method as presently constructed is an effective safeguard. And then it's, as Catherine said, and this is my slide, it's all part of the same marketplace. You won't be able to really distinguish between health marketing one moment and grocery shopping the next moment and entertainment decision-making in the next moment, because all these things have been merged. Now, we think we can do something about it, and that's part of the public interest framework we hope to do soon. But as you know, thanks, people say, and Rock Health is a big venture investor here, people are concerned about privacy, but sadly, a lot of people are willing to give up their privacy if they get free offers and services, which is part of the industry strategy. So that's just the tip of the iceberg in terms of the current state of digital pharmaceutical and health marketing in the United States.
And I think what concerns us is that this is really just the beginning of this market. So we're just beginning to see what some of these trends are going to be and what it might look like. I think it's, kind of hard to imagine how all of these things will fully materialize. But clearly, these devices are likely to be very seamlessly woven into our daily lives. And it will create a ubiquitous and continuous process of data collection, not just data collection, but all the other aspects of big data marketing that go along with that, including, as Jeff has pointed out, and we've shown you some examples, personalized marketing through the devices themselves.
Right.
And one of the big challenges, and I think one of the reasons we wanted to take on this project, because we always like challenges, is that there are, as Devin said, there are really big gaps in the regulatory framework. Yes, we do have a sectoral approach to privacy privacy protection in this country, which to me is a very faulty approach to privacy protection in the U.S.
Well, we only have a sectorial approach is because the industry has been successful.
Absolutely. No.
Legislation.
So as she said, HIPAA only regulates covered entities. I mentioned earlier, FDA generally is not going to regulate these devices, and a lot of the companies are purposely lobbying the FDA to make sure that these devices, including the ones that regulate mood, are not classified as a medical device. Because I will read a description and I'll think, why isn't that one a medical device? But they're working very hard to make sure they aren't. The FTC does have authority, but it's very, very limited, and many scholars and many advocates and many people just experienced with this world have, this digital world, have noted that the whole notice and choice model of privacy policies and opting out just doesn't work anymore, and it really isn't going to work in the era of the Internet of Things and wearables. Just mention quickly, FCC is moving into some privacy areas some of you might know about, which could be promising, but nothing directly dealing with wearables.
Well, but I would say that the one thing you can do in the next few weeks, if you are an activist and care about privacy, is to support the proposal by the Federal Communications Commission to regulate ISPs, Comcast and the Verizons. It will be the first major substantive privacy regulation in the United States. It starts with the network that carries your bits, and it would be an important step forward, and it would infect, ultimately, I think, to some extent, our health data. So it's something you need to support, and you should express it any way you can.
So what we really are hoping is that we as a community can develop a framework that will ensure that privacy is protected. It's very challenging. We're looking at a lot of different models. We would love to work with anybody and everybody in this room. We're already working with Deborah. Give you the closing line.
All right. Well, no, it will take, I mean, we have our colleagues like the Electronic Privacy Information Center and Consumer Federation of America, Consumers Union. These are part of meeting we've convened and groups we've convened, Electronic Frontier Foundation, for example, and others. It's going to take, as Catherine said, a concerted effort by health professionals, by advocates, by privacy organizations, if we're going to put a dent in this system and make sure that people have some autonomy over their health information in the Internet of Things era. Thanks.
Thank you.
So how many of you in this room have a wearable, like an Apple Watch, Fitbit, or use an app to track your nutrition or exercise or something? How many of you have actually read the user agreement in full? Okay, see, that's the problem. I wouldn't either, and I actually have some. How can we make people, you know, Jeff, you pointed out that there's 92% of people said that they should be able to control their data, but a lot of them are willing to give up their privacy. How do we make sure that the regular people on the street care about this?
How can we make sure that regular people care about it? You want to start?
Well, I would just say, I hope they care, and we really want to do more education so they understand exactly what's at stake. There needs to be a lot more done so that people can understand what the risks of privacy are. But it has to go beyond just educating people to be better readers of privacy policies, because we're really looking at such a deep infrastructure of data collection, analysis, and targeting that I believe we will need to find ways to limit the kinds of data, to determine how data can be used, not just to put everything on the consumer to even opt in to give up data. And I do think there is a way to do it. I think it's going to be very challenging, but I think there is a way to do it that will enable us to have the benefits of big data to solve a lot of medical problems without putting everyone in danger of security breaches, privacy invasion, deceptive and unfair marketing, manipulative marketing. But it's going to require, I think, a broader approach and some way, as people are talking about the FIPS, the Fair Information Practices, FIPS on steroids, some way to augment what we have with the principles that are embodied in FIPS, but that will really, really address what's new and different about this market, the technologies and the data collection practices.
And I think it will take a concerted effort. I think there has to be a lot more advocacy, a lot more complaints filed at the Federal Trade Commission. If the FCC passes something, we need to do that because they're now able to know you bought drug A or over-the-counter medicine in the grocery store and deliver to you only an ad on your television when you get home. They're even able to track you, that you're in this drugstore, and then when you get home, the ad is there. That's why you need ISP privacy, because they have your phone information and your broadband network. But we're going to have to force the industry to change. It's going to be very important to see that the Europeans do something with the new General Data Protection Regulation to raise the bar. Tremendous pressure is going to have to be put on the next administration, assuming we're still living in the United States, to see what we can do, and to call out responsible practices and to call out bad practices. But I think people need to know that they're being targeted by condition. I think people need to know that they're being tracked and their health behaviors and their racial behaviors are being merged and targeted in real time. And it's going to take us to do it because right now we really do not have a champion in government to regulate the commercial data sector, except, interestingly, the FCC when it comes to the ISPs.
And the surveys have shown that, I'm sorry,
No, go right
I'll be
ahead.
quick, that people are really frustrated, but they are also kind of cynical about what happens with their data. That the deal
Resigned. They've given
and
up. That
resigned.
was the
Yeah,
study that-
but it is, because industry talks about how it's a fair exchange and people know what's being exchanged there. People really feel like there's not much they can do about it, but they are very concerned.
So even though we spend a lot of time talking about the narrow slice of this big pie that is regulated by HIPAA, and it is narrow, certainly with respect to when HIPAA does apply, the use of what is called PHI, not PII, under HIPAA, which stands for Protected Health Information. It's a very broad definition of what's included in that. The ability to use that for marketing purposes, the rules are actually much more, are quite stringent. When the definition of marketing is met, which there certainly are carve-outs for what are considered to be public education activities when, for example, a physician sends something to patients to sort of educate them on what they ought to be doing to take care of themselves. That's not considered to be marketing, but when an outside company pays for it, particularly when it's promoting the use of a product that is the product of the person paying for the communication. It is considered to be marketing. And then the authorization that is required to be executed is not a simple check the box consent. It's actually has a number of elements that need to be met, and it's pretty stringent. Probably not all that workable, frankly, in an online context, but those would be the rules that would apply in any context, assuming that HIPAA is triggered.
Well, clearly they think that HIPAA is not triggered. And one thing we left out was there's a whole separate, and many of you know this, robust digital system to target prescribers. We only gave you half the picture. In a way, what's even more disturbing is how they're able to track and understand what physicians and other subscribers do and target them through e-detailing is what it's called, et cetera, to get them to prescribe more drugs. That clearly needs a major investigation.
One of the big kind of business models for Fitbit is now partnering with companies, and I think, Kathy, you mentioned it in your presentation, is that they, partner with companies like Target, and they give these devices to their employees. Do you think that maybe, say, once this kind of data collection happens in a workplace or through your employer, that's something that might kind of bring this issue more into the spotlight?
It could, through the unions and things like that.
It could, yeah, I think it could, and especially since the whole issue, it doesn't appear to have been resolved by the EEOC's recent decision of whether these practices might be discriminatory. I know that it's controversial, the decision, but the whole idea that if you want to get some kind of discount, on your health insurance, you really have to participate in these things. Kind of puts employees in a tough position, not to mention the sort of social and psychological sorts of factors that I think play a role when you're in any kind of institution. To the extent that people become more concerned about how this connects to the broader privacy issues that are raised by these devices, it may make people more aware of it and more, likely to be mobilized around some need for change.
And I think HHS, Devin, I'll put you on the spot, but I think that, I think you should, if, obviously we have to see what the next administration does, but workshops and investigation, call for scholarly analysis of this market. Because the fact that they say, I can target you by condition, including conditions which we know are serious, right? The fact that they can use your health data and sell it in 20 milliseconds to target you regardless of device, all these things are going on, and clearly, I'm sure it crosses the line into the area you talk about, where it should it should be covered by HIPAA, but clearly they're not paying attention because they know government's not paying attention. And that's been the biggest problem with the data collection in the United States. They know the government hasn't done anything.
Well, it wouldn't be a panel with Jeff if he didn't needle me a little bit. So I can't say that I didn't expect this.
On the commercial market.
Right. No.
Commercial market.
On the commercial market, exactly. Now, I'll say a couple of things that are relevant to that. One is that we actually do regulate employers in one capacity, and that is when they are what are called group health plan sponsors. So many times the large employers in particular are self-insured, and so there is a payment for health care component of an employer that falls under our regulations because they meet the definition of a covered entity in their plan sponsorship activities. So we have actually put out some guidance about wellness programs because some of them will be covered by HIPAA when an employer runs them through its group health plan sponsor arm, as opposed to doing it directly in its sort of employment, acting as the employer. And it does get very complicated because, frankly, to the average consumer, they can't necessarily tell where the employer is running the program from, right? Is it through the group health plan arm, or is it through the component that is the employer as acting as employer? The other thing is that the National Committee on Vital and Health Statistics, which is a federal advisory committee to HHS, recently had a day-long session on HIPAA's de-identification standards, and sort of exploring whether those are still sufficiently robust in the environment we're here today. And we are very eager to hear from them, recommendations from from what they uncovered. And so that's relevant to some of the conversations we've had today as well.
It is, but it's interesting to think about de-identification in the era where there's continuous ongoing data collection and incentives for ongoing data collection. So data that may be de-identified today, is going to be recollected and identified tomorrow, in part through these incentives. You want a discount, your loyalty program, et cetera. So that's why we have to get to the core of the problem, I think, here.
So we have to be wrapping up, but maybe is there a question or two from the audience?
I have a question, because I'm trying to think about the policy fixes that can be addressed. So recently, corporations had a law that was passed that gave them, the Defend Free Trade Acts, or it essentially gave them a private right of action if their intellectual property is breached. Okay, so my question regarding that, a couple things. HIPAA. If, in fact, it was expanded to go beyond covered entities, to include wearables and things like that, would that be one fix? And second, should there be a private right of action for HIPAA?
So those are actually a little bit hard for me to opine on. In my capacity as a government regulator, I'm not, Congress in its wisdom will determine what's the best way to deal with this. And that's probably the most that I can say about that.
You just got reappointed when she...
I'm actually career, so I'm not going anywhere.
Oh, good, okay.
You know where to find me, yeah.
Private right of action, more class action lawsuits, that is essential. That the industry's paying more attention to the class action lawsuits that have been brought around the role of data brokers, et cetera, and now apps. And now there's an important new one, or several new ones, about cross-device tracking. That's how we can get them in part, and that's part of the strategy.
Okay, let's keep this really quick.
Really quick, okay.
Okay, so you didn't touch on the ability to hack into the devices and fool them.
Right.
In other words, I can have your insulin pump be told that your blood sugar is X when it's really Y. Or I can then hack into it and do other things with it. I can then hack into your EHR, which may be connected to it.
Yeah.
So there are some other
The security issues are very important, but that wasn't part of our agreement today.
Those are great points, though, Ross. Thank you. Yes.
Thank you, guys.
Thank you for this
Thank you.
excellent panel. Thank you, thank you.